Hello, everybody. Welcome to another episode of Joy in Purpose podcast. Thank you for joining me. I hope that you're having a great day, a great week. I just pray that everything is going well for you. And if it's not, know that I'm sending you encouragements and good thoughts and praying for you as well. So I'm wishing you the very best. And some of you guys might, as you're going to as you're going through different things right now, you might also be like very busy and trying to feel like you need to catch your breath, or when is the appropriate time to catch your breath and just be you and just relax. And you might even be asking yourself, do I deserve to relax? Do I deserve to take a break? Well, this episode is for you. I am titling this episode Self-Care for Busy People. So if that's you, whether you're a parent, you're a wife or a husband, or whether you're in graduate school like me, or you have multiple jobs, you have your full-time job, you have a part-time job, or your own business as well, this episode, I believe that is beneficial for everybody, because self-care is important, and it's something that was sometimes put by the wayside. We put it to the side. And I have a guest on today, Dr. Liz. She is talking to us about self-care. How can we make self-care realistic for us? How can we make self-care an integral part of our everyday lives? So we had an amazing discussion, and I believe that you're going to learn a lot from this episode. So sit back, relax, and be ready to learn one or two things that you can take away and start applying right away, because we talked about practical ways to engage in self-care. So I'm going to go ahead and read Dr. Liz's bio, and then from there we're going to get straight to the interview. Thank you for listening. Dr. Liz is a licensed marriage and family therapist with 7 years of experience working with adolescents aged 12 to 17 and their families struggling with severe depression, anxiety, and interpersonal relationship issues. She has a doctorate degree in marriage and family therapy from Drexel University. She currently works at Hennepin County assisting adults with severe mental health illnesses. I also love the fact that she also works part-time for her own private practice by providing therapy for new parents, young women, and adolescents struggling with symptoms of depression, low self-esteem, and anxiety. This I thought was also fascinating. She serves on the board of directors for the Minnesota Association of Marriage and Family Therapy, and she's also a published author of a article, which is a big deal in the field of academia. So she's a published author of an article focusing on mental health in the Black community from a spiritual perspective. She also talked about, in our interview, she talked about how she's working on publishing her dissertation. Like I mentioned earlier, some of you guys listen to podcasts as a form of self-care and to learn is part of your personal development goals, which I really love, because I'm also a podcast listener myself. What I will encourage you to do is, just as you listen for other tips that you can apply for self-care as a busy person. Also, I wanted to point out that during the interview, Dr. Liz called me Fumi. I know that many of you on the podcast know me as Lola. My full name is Fumi Lola, so many people in my life call me Fumi, and on the podcast I go by Lola. So just wanted to clear that up in case anybody was wondering. She was talking to me when she was referring to my name, when she was referring to me as Fumi. Again, enjoy the episode. Hello, everybody. So now we have Dr. Liz joining us. I'm so excited to have you on. Thank you so much for being a guest on this podcast. So today we'll be discussing self-care. Um, I already introduced you to our audience, to my listeners, but I would like for you to tell us a little bit about yourself. So anything new or exciting that you're currently working on that you would love to share with the audience.
Sure, thank you. And first of all, I just want to thank you so much for having me on this platform and just thanking you for your time to talk about something so important. So yes, thank you for having me. I'm excited to be here. So as Fumi mentioned, I am Dr. Liz Adedokun. I'm a licensed marriage and family therapist. And something I'm working on right now, I'm pretty busy. I wear several different hats, and but right now, currently, I'm working on publishing my dissertation. So we're in the finishing touches right now. So we're hoping to submit my work hopefully by the end of next week. So that's something that will kind of free up some time for me. But that's an exciting thing I'm working on right now. Um, and yeah, just busy working and mothering and being a wife. So that's pretty much me.
That is really cool. Oh my goodness. I'm in the middle of my own dissertation, so I can just imagine
Yeah,
having to publish it. Can you
mhm,
tell us a little bit about your dissertation? Like if like maybe a sentence or two or paragraph, just a
of
little bit about
course.
yeah.
Most definitely. Yes. So my dissertation focused on attachment. So we all have different attachment styles. And mostly this happens with when a mother is pregnant and she gives birth, and that, attachment bonding begins. But there's so much research on maternal attachment, and there's not enough on fathers. And so my dissertation really focused on father's attachment and how it's super important in the lives of adolescents who struggle with mental illnesses such as depression and anxiety. So, my dissertation really just came from a big study that was done in Philadelphia. And basically, my study found that paternal attachment is super important and very essential for adolescents' mental health. So once that's published, I'm hoping to share it and continue to present about it at different conferences, because it's super important for all of us to really pinpoint the importance of fathers, right? Fathers and
Yeah.
families. So yeah, that's my work.
I love it. I was just thinking today that like mental health is not just for women, mental
Mm-hmm.
for everybody and men included. So that's really, really good.
Yes.
So you mentioned that you're a mother, you're working on publishing your dissertation, and so many things that I also know that you're working on. My first question for you is how do you define self-care? So you're a busy person, as I can imagine.
Mm-hmm. Mm-hmm.
From a clinical perspective, how do you define self-care?
Yes, such a really good question. So I would say self care is really just a way of how we restore our energy, right? So there are days when we can just feel super duper drained and tired and overwhelmed, but how do we fill ourselves back up? So it really just involves that intentional act of replenishing our souls in order to just promote, positive and healthy emotional well-being. So again, it's that intentional act. We're putting aside time for ourselves to restore our energy. So that's how I would define self-care.
Okay. So you mentioned how it is all about replenishing yourself.
Hmm.
How do we determine like when we need to be replenished? I
Mm,
don't know because like I remember this is gonna be really funny, but I remember I had a mentality when I was younger thinking that like I will rest when get a full-time job. Like as a
right.
student, why am I resting? So, like, what are some cues from our body, from our environment, or however way you want to answer this question? What are some cues that we can look out for to see, like, when we need to replenish ourselves?
Definitely. Yes, such a strong question. I think honestly for me it depends on the person. You will know, right? You will know your body. You will know when it's time to just sit down and relax, right? I work with many different clients, and you know, I'm always assessing for self-care and how they're taking care of themselves, but some typical signs are just feeling tired, right? Not just mentally, but even physically, right? Are you having body aches? Are you feeling tired when you wake up in the morning? Those, are some examples of cues to look out for. And just like signals, like, okay, maybe I need to take some time for myself. And other physical signals too, like having aches. So whether it's a headache or a stomach ache, really looking at what you're eating, what you're putting in your body. But again, that is depending on the person, right? So you will know your
Mm-hmm.
body, you will know what you need to fill it back up. But those are some typical ones, at least that I see in the work that I do with clients.
Okay.
Mm-hmm.
No, I like that. And I think just paying attention to your body when you're tired and what
Mm-hmm.
like on you. So let's say, so self-care is also popular on social media.
Mm-hmm.
People are fancy trips, they're going to Paris, they're going to the spa, they're getting massages. Like, how do we differentiate between, like, do I really need this for self-care, or am I being selfish? Like, how can we
Mm.
get that mentality of like, okay, how do I navigate? Is this self-care, or is this like just me being selfish and
Mm-hmm.
doing too much?
Right. I'm so glad you asked that, because some of my clients definitely have felt, guilty for taking time, for themselves. But I say, in order to be the best version of yourself, it's really important to prioritize you. I don't think that's a selfish thing. When we look at selfishness, it really means like we're only thinking and doing for ourselves despite the cost it may have on other people, or how it may affect other people wrongly. That's kind of how I see selfishness. Like, I'm thinking about myself and I don't really care about other people. But when I differentiate that with self care, I'm looking at that as I'm prioritizing my needs mentally and physically in order to be present for the people that I care about around me, right? So that's not like selfish thinking. In order for me to be present and available for the people that I love, for the people that I care about, I have to prioritize myself first, right? I have to say no sometimes, right? I have to know my boundaries. So there's a huge difference between selfishness and self-care. Self-care, it's really thinking about other people, right? If I want to be the best mom I can be to my kids, I have to rest my body. I have to eat well. I have to stay energized by, what I'm eating, how how much I'm resting, right? If I'm going to be the best therapist I can be for my clients, I have to, attend trainings. I have to listen to self-help podcasts, different things like that, to, again, setting aside time for myself to do those things in order to, best show up for the people around me. I hope that makes sense.
Yes, it does. Being able to do something for yourself so that you can still be there for the people in your life.
Exactly. Exactly.
So you mentioned earlier that you're a mother, you're a busy person. How do you engage in self-care as a busy person? Maybe you can use yourself as an example
Sure.
of like, how do you engage in self-care every day? Is it
Mm,
you have a schedule? Because I can imagine many people are busy. Maybe they're students like I am, and they're like, I get it. I see the point. Okay, it's not selfishness, it's
mhm.
self-care. It's about replenishing myself. How do we make sure that we make this into like a lifelong practice?
Sure. Yeah. And I'm, very happy to use myself, as an example. Yes, I'm very busy. I have two young kids under 3. I'm also a wife, so I have a home that I have to take care of every day. But something that really helps me is utilizing a planner, and really just, how we all prioritize our meetings. We have meetings at this time, but really having a meeting for yourself, like literally writing it down in your planner so that you know it's coming up, so that you can prepare for it, and so you can be intentional about it. This is an hour for me. This is not an hour to do what I have to do or run an errand. This is an hour for me to sit down with myself and doing something that makes me happy and lifts me up. So really, some people, don't do well with planners. And so I'm always encouraging people to maybe wake up a little bit earlier, maybe 10 minutes earlier, just to do some deep breathing, or, enjoy a cup of tea by yourself in order to get ready for a busy day. And then when you are done with the busy day, right, um, really paying attention to your bedtime routine, incorporating something at that time. So I think it's really a matter of how do you structure your day, and maybe writing that out so you can see everything that you have to do in that day, and incorporating some type of self-care, whether in the morning, in the afternoon, or in the evening, but really making sure that it's at least 30 minutes at least. I know we all work and we all are busy, but we definitely have breaks too. And you're going to make time for what's important for you, right? So self-care really needs to be at the top of the list, in my opinion. So,
No, you're definitely making a case for it, especially like I keep going back to that word. It's about replenishing yourself as you
mhm,
are a mother, a wife, a therapist, like to be the best version of yourself for those roles that you are.
exactly.
you have to replenish yourself. Um, can you tell us a little bit about your journey with self care?
Yes, definitely. I am going to be honest. I wasn't always very good at self care until my body literally shut down on me. And I was just extremely overwhelmed. And I think that was just a huge shift in how I started to incorporate self care in my day. I'm a huge reader. I love to read. So I read devotionals. And just really making the time to do that has really helped me. And also just my mindset, right? Like I'm doing all these things and, I'm caring for children, I'm, writing articles, I'm seeing clients, but really thinking, what am I doing, all this for? Is it really worth, you know, um, overwhelming myself, right? I want to be able to still enjoy life, right? Life is not all about work, busyness. It's about enjoying life because life will just pass you by and you'll get to a certain age and you'll just be like, wow, where did the time go? So I think it was a mindset change for me. And of course, a physical change for me when my body just told me no.
Mm-hmm.
But those were two big things for me. It's like, if, like I said earlier, if I'm going to be the best wife I can be to my husband, the best mom I can be, what am I doing for myself in order to meet that? So it was a huge mindset change and physical change for me.
Yeah, I see why you say we should pay attention to our body because it
Hmm.
would definitely tell us.
Yep, exactly. Very true.
So the final question before I ask how you would like the audience to connect with you, can you give us other examples of self care, especially for someone like me who is a student?
Hmm.
Who is like, okay, I'm not working full time yet. Maybe I'm someone is working part time, but they would
Hmm.
still like to engage in self care. Are there other examples that you can think of? Maybe things that we're not doing right now that we can try that is affordable, it's
Yeah.
realistic for a busy person.
Definitely, definitely. I always tell people to utilize your weekends, especially students. I get it. Like maybe some students want to save the weekends to catch up on homework or reading, but utilize those days. Saturdays and Sundays, those should be days for really resting. So utilizing those days to do things that make you happy. That could be Netflix, that could just be resting. Some people just like to rest. Doing things like that. One thing I also wanted to add, when it comes to self-care, I kind of focus on three components. So there's a mind, there's a body, and the soul. And for the mind, of course, there's so much research that has been shown that meditation just has so many positive benefits. And so finding time, like I said, to just have some deep breaths, right? Like just breathe, and just being mindful of your thoughts, right? What are you feeding your mind? And then the body, right? We want to rest. We want to eat right, having enough vegetables and fruits so that we can feel energized, so we can feel alert. And soul is really just how are you lifting yourself up, right? It's different for everybody. I know for me, like I pray, I listen to worship music every Sunday before church, even before church, just to prepare, the day. So how are you lifting yourself up? Um, One thing I do with clients, I know I've worked with a couple of students, is really just doing like some grounding exercises, really hitting those five senses. You can incorporate self care into that. So, like for smell, I know what's popular is these essential oils. There's the popular one, lavender oil, right? So, people just kind of taking a deep breath and having some lavender oil, around you. That's kind of calming, right? And for taste, right? Eating a good meal, making something different, going out to eat with a friend, and then for hearing, the sense of hearing, you can listen to a self help podcast. You can listen to really cool audiobooks. For sight, you can watch a good movie. There's so much on Netflix. There's YouTube, watching something with loved ones. And lastly, for touch, I put here hygiene, right? Taking care of your body, taking a bath. I mean, I use Epsom salt. I think it's just so many benefits of that. It just releases toxins. It, calms you down. It helps with muscle tension. taking care of your skin, right? Moisturizing your skin, taking care of you. Um, so those are some ways I would say, that you can incorporate self-care.
I really love those examples that you gave because they're so simple.
Hmm.
Some of us, maybe we haven't watched the movie, or even there's some movies that are just like so beautiful to watch because of the country was shot in or something like
Right.
that. Or like maybe you haven't watched a movie, but you can watch it with your loved ones. Like come out of your bedroom and watch it with family in the living room and not
Exactly.
by yourself. So I really love that. And it's so realistic, affordable. Like if you're going grocery shopping this week, you can buy some episode salt.
Exactly.
I
Yes.
use that.
I use it too all the time. It's so amazing.
Nice. Is there anything else you would like to share about this topic or anything else with the audience before we close out?
No, I just hope that the listeners just really understand that self-care is, it's not a selfish thing to do. And so I'm just hoping that people don't feel guilty about setting aside time for themselves. So that's kind of the last thing I really wanted to share on that.
I like that. So, how can the audience connect with you? Like, they've heard you, they love everything you're saying about self care, and they would like to learn more. How can they connect with you? How can they find you on the web?
Sure, yes. So I am on Psychology Today. That's a pretty well-known platform to find therapists. Sadly, I am booked to capacity, so I'm not taking on new clients, but I am available for consultation. So, yes, I am on Psychology Today. I'm also on a platform called Therapy for Black Girls. I am working on becoming a therapist for Therapy for Black Men. So, if anyone's out there who specifically, needs a therapist of color, those platforms are available. And then lastly, I am on social media. My Instagram is Dr. underscore Liz underscore Ade, ADE. And so people can find me on there. And I'm typically just sharing little tips on just how to enjoy life. Life is so short. So hoping that my audience will just feel encouraged by my platforms.
I love that. That's so nice. Thank you so much for being on, and I really appreciate you sharing your tips and your
Yes.
expertise with us.
Thank you, Fumi, for having me. I really appreciate it.
No problem. Take care.
You too.
I really, really enjoyed talking with Dr. Liz. I really hope you were able to take one or two tips away from our discussion and that you start to practice self-care and you make it an integral part of your everyday life. Until next time, take care. Bye. Welcome to the Joy in Purpose podcast. My name is Lola. I am the creator and host of this platform. I am also a doctoral student in a psychology program. Joy in Purpose is a podcast dedicated to conversations about purpose, career development, and mental health. I also interview individuals to share their purpose stories. In today's episode, Kenny, my brother, will share his career journey and how he helps individuals who are undergoing career transitions. Before we begin the interview, I would like to remind before we begin the interview, I would like to remind our listeners that this podcast is not a replacement. Before we Before we begin the interview, I would like to remind our listeners that this podcast is not a replacement for therapy. Information shared on this platform is for educational purposes only. Thanks for listening. Thank you for listening. I hope you enjoyed that episode and learned some tips that will positively impact your career development. I love what Kenny said about not just focusing on the hard skills, but on the soft skills as well. And he also talked about confidence, which is so important. I like this perspective on looking at our resumes, your resume, from I hope you I hope you and I hope I hope you enjoyed that episode and learned some tips. I hope you enjoyed that episode and learned some tips that will positively impact your career development. I really like the fact that he looked at I hope I hope you enjoyed that episode and learned some tips that will positively impact your career development. Don't forget to rate and review. Don't forget to rate and review. Okay. I hope you enjoyed the episode and learned some tips that will positively impact your career development. Don't forget to rate and review this podcast, Joy in Purpose, on Apple Podcast. Thanks. Thank you for listening. Bye bye.